can the person do at home just from an oral health and cleaning? Like I said to you, obviously don't use any fluoride. The mouthwash that I use is totally natural, but maybe talk about hydrogen peroxide and a water pick, or, flossing, brushing of teeth, how important that is with the process in terms of before they see you or during the process or even afterwards.
So what I always say is 3 things you should avoid if you want to have optimal oral health. And this is fluoride, toothpaste, chemical mouthwashes, and flossing. Don't do that things. Those things are actually making it worse. You don't want to disinfect your oral microbiome on a daily basis with some chemicals or using fluoride. Instead, what we do, or what we focus on when it comes to oral healthcare strategies, is if you want to brush your teeth, use a toothbrush, a toothpaste that is as natural as possible. Because most toothpastes are not just fluoride. They contain titanium dioxide, E171, which is a white color. It's really an immune disruptor. They contain triclosan. They contain SLS, which is sodium lauryl sulfate. Okay. Basically a foam, because it foams so nice, but it's a foam in your mouth. There's also a lot of artificial sweeteners to make it taste sweet, because otherwise it tastes like crap. And nothing tastes good after regular toothpaste. You cannot even eat anything afterwards. It just tastes so bad. There's so many toxins in there that I would never put into my mouth, because I only want to put stuff in my mouth that I would like to eat, actually, because it gets absorbed. It even gets absorbed from your gum tissue. It's already skin, there's diffusion, and if you have any sort of inflammation, it will go in there. So no regular toothpaste, go as natural as possible. And I personally brush my teeth once a day, but I have to say that my diet and lifestyle are in check. So I have no plaque, no biofilm, nothing. And I also never had any dental work done besides orthodontics. I have no cavities, nothing. So my teeth are hard as stone, like stone hard. And this is how nature has it designed. But this is depending on your nutrition. If you still eat the standard Western diet or the standard crappy foods, you might, with all the convenient foods, might even have weak teeth, and you might need to brush a little bit more often because you have more biofilm. Depends on you. I do it once a day. I use an electric toothbrush, but it doesn't actually matter. Then the second strategy, oral healthcare strategy, is called tongue scraping. It's an ancient Ayurvedic strategy. And what you do is you basically scrape off the bottom of your tongue, because overnight a lot of food debris, toxins, bacteria, viruses will kind of get stuck there. And generally a dentist will use a plastic tongue scraper. It's okay, but it's better to use a copper tongue scraper. Copper has also been shown to be antibacterial in itself. So in Ayurveda, you always have a copper, let's say a copper tub, where there's always fresh water in it to be disinfected from the bacteria. So copper tongue scraper would be a solid strategy to do that every morning or evening, depends on your strategy. And the third one for oral healthcare strategies is oil pulling. Again, it's Ayurveda, and specifically I would do coconut oil pulling, because coconut oil, extra virgin coconut oil, contains lauric acid, which is a strong antiviral. And you just need that oil or that fat to take a tablespoon into your mouth and just have it in your mouth and swish it gently around for about at least 5 minutes to 15 minutes. You could do that, for example, while you're cooking breakfast in the morning. It doesn't matter if you do it before brushing, after brushing, or even on its own. You can also upgrade with essential oils, but just basic coconut oil will do the trick, extra virgin coconut oil. It will bind toxins. It will, again, be antiviral, antimicrobial purposes. But what is important is after 5 to 15 minutes, you should spit that out, because it contains all that stuff. Sure. Don't swallow it. It will be a bomb otherwise. It's really also soothing to your gums. Yeah, your gums is outside skin. It's like here, it's a barrier. And if your gum is nice and clean, and then it's pinkish, it's not red or inflamed or it's bleeding. It never bleeds. If it's bleeding, it's a sign of inflammation. It's called leaky gum. Everybody has heard of leaky gut. It's the same concept. It already starts at the entrance of your gut. And your mouth has a lot of pathogens. And this is how they find oral pathogens in your hip joints. Because if you have an inflammation here, Porphyromonas gingivalis or strep mutans can just jump in the system and take it from there. As same as with the COVID virus. COVID virus will go, if the barrier function is a little bit off, leaky gum, it just goes in easy instead of being perfectly repelled by your oral mucosa and the immune system that lives there. So you should never have any inflammation in your oral cavity. And this is also point number 4, why I don't floss. Because, be honest, most of you guys out there who use a floss will be, you already said it. Yeah, because it's just so difficult to get that floss in between there without ripping, and it will cut open your gum. And it's the same thing as always cutting your skin. Would you cut your skin twice a day and then hope that no bacteria goes in there? Of course not. You produce a ton of inflammation and it's just unnecessary. That being said, if you had a ton of dental work done and you have crown work and there's a lot of food stuck in the teeth, you might need to do it. But with all natural healthy teeth like I have, don't do it.